you very much. And can I begin by thanking Carers Scotland for the opportunity and the invitation to come along. And apologies if I'm a little bit breathless at the start of that speech, because we had the joys of not getting quite dropped off where we thought this building was. And apparently I'm not the first one that day to have that experience. So we'll try and deliver this speech as best I can, having a wee jog here before we got here. So, as Paul said, I'm the new Cabinet Secretary for Social Security and Older People, and it really is a privilege to be able to come here and be able to speak to you all at this Carers Parliament and to tell you about the work that we are doing to deliver those benefits that we will be responsible for within the Scottish Government. That obviously includes carers and many disability payments. I know many of you will have taken part in the workshops around social security, and can I thank you for that time that you've spent, and my officials will update me on the details if you don't get that opportunity to do so in questions, to share your views on all the aspects that you will have covered. That really does mean a lot to have that feedback. It is, after all, how we are building our system. So I want to be very clear at the outset that the government, not just in social security and in my remit, but across our portfolios, does recognise the enormous contributions that carers make to our society. The role that you fill with friends, family, neighbours, and the people that you care for is something which is invaluable in our society. And I do understand that while it can be in many ways a rewarding experience and you make a huge difference to the cared for person, it can be exceptionally hard work. It can be under challenging circumstances and has an impact on your own health and well-being. And I know, having the opportunity to have followed some of the discussions today on Twitter before I came down, there was a great deal of discussion around isolation and loneliness, for example, in some of the discussions earlier on. That's again something which falls within my portfolio as well, the loneliness and isolation strategy. So I watch that with great interest in the feedback that will come from today on that. But this event, not just on that issue, but on a whole range of issues, provides a platform for carers from across Scotland to be able to come together to share your experience and to input into our policy development within government. And that is because we want, as a government, to improve the support that is there for carers. We want to be able to help people continue to care if they wish, but to do so in better health and with a lifelong support while they're doing their caring role. And your expertise in that will help us deliver the support that meets the needs of you, both in social security and elsewhere. And that's why these events are so important. I do understand that it's not just carers' benefits that are important to you, but I will spend a little bit of time talking about them today. But I want to begin by talking about social security more generally. The Act, as I'm sure you're aware, establishes a social security system here in Scotland that will be responsible in total for around 15% of benefits. It is the only UK-based social security system that has the principle of seeing social security as a human right, and that's a very important distinction when compared to the rest of the UK. We are undertaking the largest, most complex programme of change since devolution began, and by the end of this parliamentary term we'll assume responsibility for 11 benefits, making us responsible for payments to around 1.4 million people. I want to reassure you, first of all, that the most important thing for me and for the agency is that anyone currently receiving benefits will continue to receive what they are due. That safe and secure transition is our top priority. And to deliver this work, we have to work with our UK counterparts in the DWP. We are reliant on them to fulfil their obligations and in a timely manner to allow us to fulfil that programme. I'm sure you can appreciate that is not without its challenges, but very important that you receive an assurance from me today that we will do everything within our power to deliver a service that you can be proud of and that the people of Scotland can be proud of. So we have developed our new agency, Social Security Scotland, to deliver those benefits, headquartered in Dundee. And we're building that agency, all its systems and all its policies, in partnership with those who have a lived experience and also with carers organisations. So for example, the Carers Trust and Meacock Carer Centre have worked directly with agency staff to help them to understand the day-to-day experience of carers. So that induction of our staff has a very important aspect around ensuring that they're hearing directly from people with lived experience. To date, the agency has answered over 8,000 inquiries, and the majority of those, unsurprisingly, have been on the Carers Allowance Supplement, which was the agency's first payments that they made. The feedback to how those calls have been dealt with has been overwhelmingly positive. But I would encourage people, if they have not done so but have had contact with the agency, to deliver feedback and give your suggestions out there, because we want to improve and very much are open to ensure that we are doing so. We are, after all, trying to build a system that treats people with dignity and respect, and that has to involve us being open to learn, open to feedback, and that's a very important part of our learning process. Now, we are absolutely committed to the co-design of everything that we do with people with experience of the current system. For example, we are co-producing a charter with people with lived experience, including carers, that will explain in clear and concise details what people are entitled to expect from this new system. And that charter will also be approved by Parliament. Our Social Security experience panels have over 2,400 volunteers with experience of current UK benefits, who are helping to build a system that works for the people of Scotland. And the important aspect to stress again is we're not looking to make minor changes to the current system, but we are looking to build a new system for ourselves. So we're listening to what people need and what people want, and we'll continue to listen. The carers from the experience panels have been involved in every step of the process, from testing the system to developing the Carers Allowance Supplement notification letter. And the decision to raise awareness of the payment in advance of those letters within press and radio came directly from experience panel input. Carers did indeed tell us that if a letter came out the blue from an organisation, an agency that you'd never heard of, telling you that you would be getting money into your bank account, the first feedback we got within the agency was that it was a scam. And did people actually know who the agency was, and to be reassured that it was something that was legitimate and you could have faith in. But I want to speak to you now about specifically a little bit more about the carers' benefits themselves. As I mentioned, the Carers Allowance Supplement was the first payment that the Social Security Agency made. And the reason for that is it's simply unfair that the carers' allowance is the lowest of all working age benefits. That's why we increased the carers' allowance through the supplement to the same level as job seekers' allowance, an increase of 13%. But to allow us to pay that increase as quickly as possible, it was important that DWP continued to pay the carers' allowance, and Social Security Scotland paid the carers' allowance supplement. That was the delivery mechanism that allowed us to deliver that payment in the quickest way possible. So we are dependent on the DWP for the data about who's receiving carers' allowance at eligibility dates, and that supplement is paid in 2 6-month lump sums based on those qualifying dates. So the supplement payments began in September, a landmark moment in devolution, and it puts an extra £442 a year into carers' pockets. The carers' allowance and the supplement will be uprated in line with inflation, and the next round of carers' allowance supplements will start in December. I recently met with some carers at the South West Glasgow Carers Centre, and I'm grateful for the time that they spent with me, and they told me about the difference that the supplement will make, not just financially, but also that they felt more valued as a carer. But we also spent a great deal of time about talking about their concerns, that the increase in support will be taken away from them, for example, from the other support they receive, leaving them no better off. And I want to reassure you that we have a formal agreement with the UK Government set out in legislation that additional benefit payments won't be clawed back elsewhere. But our work on carers doesn't stop there. The implementation of the Carers Allowance Supplement was the first step on our journey to delivering carers' benefits within Scotland. So I'm also pleased to be able to tell you that the agency has applied to Carers Scotland for a carer positive employer status, and I know from my own experience as someone who already has that status as a constituency MSP, that this has the potential to better support carers to balance paid employment with caring, and it's an important process for the agency to go through. I also know that part of the discussions from earlier on were around young carers. I know Joe Fitzpatrick met with some young carers over lunchtime, and again, I was very interested about the tweets that were coming out from young carers who spoke this morning, and the importance that they placed on government ensuring that we recognise that they weren't just carers, but they were young carers, and appreciated that role. So I know from the meetings that I've had with young carers from coming into this position that it can be difficult for them to do things and to access the opportunity that in many ways is the norm for their peers. So caring shouldn't, of course, be a barrier to learning, to work and to leisure that a young person should access. That's why the First Minister announced a new package of support for young carers, a new young carer grant from 2019, a £300 annual payment for young adults with significant caring responsibilities who don't qualify for carers allowance. Recipients of the grants will also be eligible for free bus travel from 2020-2021, and a bespoke carers element to the Young Scot National Entitlement Card will be rolled out from April 2019. We've also established a young carers panel, a subgroup of our wider experience panels made up of young carers to ensure that young people can share their experiences and help shape the development of that young carers grant, ensuring that the grant is delivered with rather than for young people. The Young Carers Grant is a new benefit. It's one that doesn't exist in any other part of the UK, and the public consultation to that is still live at the moment. It closes on the 10th of December. And if people haven't done so, I would encourage you to take part in that consultation and to encourage others to do so. We've also, as a government, made an additional commitment for carers in light of our new social security powers. They will introduce an additional payment to those caring for more than one disabled child, and that will be implemented by the end of this parliamentary term. And I want to turn to disability benefits and discuss some of the developments in disability benefits. We are committed to delivering those benefits before the end of this parliamentary term, and our human rights-based approach to disability assistance means that it's a person is at the centre of this process. We are clear that we can only deliver an effective system, again, through engaging with people with lived experience of the current system. So through our engagement with individuals, we have repeatedly heard, and I know this through my own constituency surgeries, about the stress, the trauma, the anxiety, the ill health that's caused to people by the current assessment system. It's a system that's failing people. It's been widely criticised, not just by this government, but by the Westminster's own Work and Pensions Committee inquiry, for example. So we are committed within our system to significantly reduce the proportion of people that are required to attend a face-to-face assessment. Individuals shouldn't be required to go through such a process unless there's no other practicable way of making a decision about their entitlement. But the important aspect as well is that if that assessment is deemed necessary, it has to be carried out within a process where fairness, dignity and respect shines through and done by appropriately qualified assessors. So in order to achieve this, Social Security Scotland will deliver those assessments to determine eligibility for disability assistance, fully supported by public sector healthcare professionals. This government is determined to ensure that there is no place for the private sector in the delivery of our social security system, and that also people can be assured that they can access a flexible system. And I believe that the agency itself is best placed to deliver that. So from application to award, we will provide a service that covers the length and breadth of Scotland, where we will directly manage the assessor performance and the assessment quality and the outcomes. We want our system to be able to ensure that individuals have choice and flexibility, taking into account the distances people are expected to travel and their location preferences. and when invited to an assessment, it will be at a time that suits them. For those who have difficulty in travelling to an assessment centre, we will provide home-based assessments to those who need them. And we want to build trust with people, and that trust is very important because they certainly have no trust in the current assessment process. So we'll introduce audio recording of assessments as standard. We want people to be confident in the knowledge that there's an accurate record about what happened in that assessment process and everything that's been said during that. Now, it is our intention that robust decision making and a thorough redetermination process will bring a marked reduction in the number of decisions that will be taken to appeal, but there will still be instances where individuals challenge that decision about their entitlement, and of course they should have the right to do so. So we want also to get those appeals right, and we'll ensure that the tribunal can use the audio recording to inform their determination. Touching now on child DLA, we appreciate the issues which children with disabilities and their families can experience, particularly in the transitional period, 15, 16, 17-year-olds. That's why children in receipt of DLA will therefore be given an automatic award of that benefit up to the age of 18. That will help to mitigate the difficulties children experience during their time of transition from child services to adult services. Now, in closing, I'm very proud of the work that we have done with regards to social security and in particular to disability benefits. I think it demonstrates how we are determined to embed dignity, fairness and respect in everything that we do, and that will continue to be our major focus. And we're determined to ensure that we continue to engage with major stakeholders, our experience panels and individuals as we move towards delivering our disability assistance up here in Scotland. But I want to restate this government's commitment to doing all that we can to support carers and the value that we place on that. As well as having dignity and respect embedded through our social security, we have to ensure that everyone, including carers, has trust in our benefits system, that you feel it's your system, not my system, not the government system, but your system there to support you. So with that in mind, I would again like to thank the stakeholders, the expert groups, the experience panels, our core reference group, everyone who has done so much to get us to the point where we are with our social security system and to deliver it in the pace of change that we have. The views that you have provided today in the workshops and in the earlier plenary session is part of that journey. So I would thank you very much for that, but I am more than happy to take some questions from you all as well before I have to go back up to Parliament. So over to you, Paul.
Thank you very much. So, questions, hands. Must have been very clear. There you go, lady over there.
Hi there. Just at the very end there, you said that you were going to commit to extending a child's DLA automatically to the age of 18. Can you tell us when that will be from, please?
Will we take them in a round?
Yeah, have you got any, so there's a colleague at the back.
Yeah, I was just asking the carers grant. Have you ever thought like looking at for young adult carers, the ones over 16, but also I was in the workshop for the young carers grant, which was only entitled to those 16 to 18. What about the ones under 16, the 14s, the 13s and the 12-year-olds? Also, what about if there's two young carers in the same household? Because just like myself, I've got a younger sister that is 2 years apart, and going back thinking, what about if I'm 18 and she's 16? Would she be able? What about the young carers that have got the same, are in the same situation?
Okay, maybe one more question. Anybody? Okay, you'll get off with two questions then.
Okay, you can think of some more while I'm trying to answer these ones. When it comes to the child DLA aspect of it, we will take responsibility for all of the benefits that are getting devolved to Scotland within this parliamentary term, so that will be before 2021. We haven't determined the time frame for when those Wave 2 benefits will come on stream, the child DLA, PIP and attendance allowance. And one of the reasons for that is it's not just our timetable that I have to have faith in, it's the DWP's timetable as well. So as soon as we're in a position where I have faith that it will be deliverable, not just by us, but by DWP, we'll be able to give more details about when that will be. So that will hopefully give you a little bit of a time frame as well, as far as we can at the moment. In relation to young carers, this is exactly why the consultation is so important, and it talks about some of those aspects within the consultation document, whether encouraging responses about if there are 2 young carers in a household, or indeed whether there is more than one person being cared for within a household as well, is a particular question that comes through. And it's those different aspects and the impact that that has on individuals and on their families that needs to come through in the consultation, but is also coming through in the discussions we're having with young carers themselves. So if you haven't already done so, please respond to that consultation. And I'm very aware of this. When you're developing legislation, there has to be start dates, end dates, ages where things are applicable, and ages where they end. And what I want to ensure is that while we're looking at the legislation, we're not just seeing the legislation in isolation, but it's what else is also out there for young carers as well. So again, this, I'm very aware that you don't start caring when you're 16. There are other younger carers out there. So the fact that the Young Carers Grant is made eligible to that group of young carers, I'm very determined we don't see in isolation from what else is going on out there. So that's one of the aspects which I know that we need to look at, is what support are we giving to younger carers out there as well.
Okay, thank you. I'm getting the look from over here, so we'll take one last question and then we'll let you go.
I was just seeking reassurance. Thank you. Just to seek reassurance that there won't be any expectation that applicants won't have digital access, that you will take into account that not all the ambitions for digital access in Scotland will be achieved within the time frames that they're supposed to. Thank you.
It's a very easy question to answer, so I'm happy to take another one if we have to, and I'll bear the wrath of my private office when I get in the car. There's absolutely no way that we will have a system in here which assumes you have access to a computer, an email address, a mobile phone number to get a verification code. Absolutely not at all, because quite frankly, it doesn't work. And it ensures that you bring barriers into a system and create more stress and anxiety rather than supporting people through the process. So there's an enormous amount of work that's going on to ensure that the online portal and application forms are built with people, and they're being built in conjunction with individuals, but there will also be paper copies. You'll be able to do it on the phone, you'll be able to do it with the support of people from local services as well. So absolutely no way we will have a system that makes assumptions about people rather than building it on what people need and what people want, because it's, as I say, it goes back, it's your system, it's not my system.